Hello classmates, I'm Jewel and I'll be talking about my signature assignment topic, scoliosis. Here's the outline of the things I'll be going over. First, I'll introduce you to what is scoliosis. Scoliosis is a condition involving a lateral curvature of the spine, an appearance of a curved S or C shape with a rotation of the vertebrae. Three-dimensional curves on the coronal, sagittal, and axial planes can occur as well. Over here, there's an image of a straight spine and a spine with scoliosis on the posterior view. On the straight, healthy spine, there are vertebrae stacked upon another on the mid-sagittal plane. Meanwhile, spine with scoliosis have lateral curvatures to the spine, going away from midline towards the side of the body. Some visible appearance or symptoms are when one shoulder is higher than the other, one's leaning to one side. Most cases are mild and don't need treatment from curves between 10 to 25 degrees. There are three different types of scoliosis: congenital scoliosis, idiopathic scoliosis, and depending on the time and age of diagnosis, whether it be infantile, adolescent, or adult. Adolescent idiopathic scoliosis is the most common type, as it covers about 80% of all scoliosis cases. And then lastly, there's neuromuscular scoliosis. All forms are progressive and should be monitored closely using x-rays to check if there's any progression of the spinal curve. The cause of scoliosis depends on its type. For idiopathic scoliosis, idiopathic meaning unknown, which is pertaining to its cause. However, there are linked risks to having idiopathic scoliosis, such as age, sex, and family history, which I'll be going more in depth on the demographic slide. As for adult idiopathic scoliosis, it's caused due to an asymmetric disc degeneration due to age. Then there's congenital scoliosis, congenital meaning present at birth, and is caused due to abnormal development. And then there's neuromuscular scoliosis, where formation of scoliosis is due to a neuromuscular disease, for example, cerebral palsy, paralysis, and muscular dystrophy. Other types can be caused by trauma to the spine or tumor, where the tumor is in the space of the normal vertebral column. Risk assessing with AI, artificial intelligence, and machine learning have made improvements in spinal imaging for detection and classification for scoliosis, boosting diagnostic accuracy. Since each scoliosis case is unique, it can help guide treatment plans and foresee patient outcome, and it can also give more information and diagnosing. Moving on to demographics, the people that are most likely to develop the disease or at risk are in adolescent years. Adolescent idiopathic scoliosis is the most common type. Occurs from the age of 10 to when a child is fully grown. Some curves worsen as a child grows due to rapid growth, like in puberty, and the average curve acceleration is from the age of 11.7 years. Mild scoliosis develops at the same time for boys and girls. However, it's seen that girls have a much higher risk of developing a greater curve and therefore needing treatment. Family history has also been linked when someone else in the family has the disease. However, that's not apparent in all cases. The presence of scoliosis around the world. In the United States, 2 to 3% or about 9 million people have it. In Chongming Island in China, it accounted for 2.52% of the population. The data accounted for about 6,800 children, where researchers went into schools and checked for the presence of scoliosis of children between age 6 to 17. The epidemiology of scoliosis can vary around the world. However, there is no data where it shows that scoliosis is more predominant than in others. More research has to be done. Now I'll be going over the anatomy of a normal spine. There are 33 bone vertebrae interconnected by fibrocartilaginous joints in the intervertebral disc. Over here I have an image of a spine in the posterior view and in the lateral view, where you can see the highlighted 5 regions of the spine: the cervical, thoracic, lumbar, sacrum, and coccyx. Each region has a number of vertebrae. In the cervical region, there are 7 vertebrae, where they have a unique feature in the C1 and C2. And the C1, also known as the atlas, is where the spine and the skull meet. And the C2 or axis, there is a feature called the dens that allows the C1 and the head to rotate. And then in the C7, there is a vertebral prominence, where when you bend over, there is a prominent lump or bump in the back of your neck. In the thoracic region, there are 12 vertebral bones, which are connected to 12 pairs of ribs. And then in the lumbar region, there are 5 vertebrae, which support the most weight. And then in the sacrum, there's 5 fused vertebrae, and then the coccyx, there are 4 fused vertebrae. The movement of the spine includes flexion, extension, and the lateral flexion, extension, and rotation. Now we'll go over the basic features of a vertebra. Over here is a lumbar vertebra. I know that because of the big vertebral body and its oval shape. The cervical and thoracic have unique features to its vertebra, like how the cervical has 3 foraminas, meanwhile the thoracic has a smaller vertebral body compared to the lumbar and is heart-shaped. I'll use this one for reference. So over here is the superior articular facets, where the vertebrae articulate. Over here is the vertebral bodies, where the spines stack upon one another, and in between are the intervertebral disc. The vertebral foramina, which houses the spinal cord, the transverse process, and the spinous process, which points out posteriorly. Over here, there's a spine, where you can see the spinous process in the mid-sagittal plane. Over here, you can see the misalignment of the spinous process, and that is a spine with scoliosis. The physiology of the spine provides the main support of the body, allowing the body to stand upright, bend, and twist while still protecting the spinal cord. Most vertebrae are able to move to allow for greater range of motion. On the image over here, the spine is seen in the lateral view, where there are natural curves to the spine, a concave, convex, concave, which act like a coiled spring to absorb shock, maintain posture, and allow for greater range of motion. Meanwhile, the physiology of a spine with scoliosis involves an irregular lateral curvature in the coronal plane. Over here, there's a spine that is straight and doesn't have scoliosis. Over here, these are different types of scoliosis. A thoracic scoliosis, where there's a curve on the thoracic region, on the lumbar region, and in the thoracic lumbar region. This makes a C-shaped curve. It can either be concave or convex. This one in particular is concave, going on the left side, concave left, and a big concave one over here. A combined scoliosis is an S-shaped curve, where there's a concave and convex curve in the spine. Symptoms are mostly physical appearance, as they are leaning to one side, asymmetry on the neck, shoulders, ribs, waist, and hips, as well as pain and discomfort. Long-term consequences, if not treated, some scoliosis curves progress over time, while some stop. There's been linked to back problems later in life, as well in severe cases it can affect other organs. The mortality rate is high and there are no deaths. Diagnosis involves a detailed medical history, a physical exam to check for symptoms, spinal misalignment, and to check for the Adams forward bending test, which is when a person bends over with their arms hanging to check if there's any irregularities in the back, such as the predominance over here. A neurological exam can also be done to check for muscle weakness, numbness, and reflexes. The X-ray is a primary diagnostic tool for detection to measure the curvature of the spinal curve. Over here, an X-ray has been done, and a healthcare provider has inserted points to generate a curve. A 10-degree or more is a positive diagnosis for mild scoliosis. 25-degree or more is significant, 50 is severe, and 85-degree or more is very severe, where it could affect other organs such as taking space of the lungs. Scoliosis is a chronic disease. There are no drugs to help assist with fixing the curve. However, the goal is to stop the curve from progressing more. Integration of behavioral modifications, such as good posture, and the watch and wait approach to check if the curvature gets worse. A back brace if the scoliosis is significant to help change the posture and to an upright position. For severe scoliosis, spinal surgery is necessary to manually align the spine. There is no guarantee that progression won't continue even after surgery. AI assistants can help improve accuracy in measuring the spinal curve compared to a healthcare provider doing it manually. Finally, here's my reference slide. Thank you for watching my signature assignment topic, scoliosis.